My name is Dr. Cassandra Lee, and I'm the Chief of the Sports Service at UC Davis Health in Sacramento, California. This is a demonstration of the use of the UltraButton quad and the UltraButton tib in preparation of a soft tissue quadriceps graft that can be completed in less than 5 minutes. For this demonstration, we have the UltraButton quad, the UltraButton tib, the reduction bars, sizing block, X-Wing graft prep board, and surgical instruments. We take our harvested graft to the back table. I measure 15 millimeters for the distal end of the graft, and this is what came off the patella. And then I actually mark 20 millimeters on the proximal end of the graft because the actual delamination that occurs when you harvest the proximal portion of the tendon graft. This is a slide that I'll put into the tibia. This is a card for the large UltraButton tib. We had pre-sized the graft during harvest, and this corresponds to the size button you choose. Unpack the UltraButton, leaving the smaller card with the sutures intact. Place the needle through the mark from the top down, pulling the sutures all the way through. As I get to the UltraButton sutures, I will cradle the graft to support the graft so that I can pull the sutures up all the way into the button itself. From the blue suture, open the suture loop to pass the suture card through to create your luggage tag stitch. Pull on the button to cinch the luggage tag around the 20 millimeter mark on the graft so that it's snug. Pass the blue suture top down just beyond the mark and the luggage tag suture at around 21 to 22 millimeters. Place the sutures and the card proximally to get them out of your way. We open the sutures and pass our suture 2 more times distally to create a whip stitch at the end of your graft. Here we tighten the whip stitch to tubularize the graft. You can even pass more whip stitches if necessary, but a minimum of 2 are required. With the 2 whip stitches done, my 5th and final pass is passing the needle top down through the graft and then creating a locking stitch by passing the needle through the loop. Afterwards, you can cut the needle off the sutures, trying to leave the blue sutures as long as possible. This is the UltraButton quad, and we will prepare the patellar side of the graft in the same manner. Here's a prepared graft, and we will perform final sizing prior to drilling our tunnels. The graft construct is then attached to the X-Wing to tension the graft to 100 newtons to remove creep. As the collagen fibers relax, you may have to dial this a few more times to maintain that 100 newtons.